Hi everyone, I'm Russ Knapp, owner of Comfort Keepers. We are so proud to be a longtime sponsor of Petoskey Chamber's Hot Topics series. The series is dedicated to bringing education and awareness to important community issues. I hope you're having a wonderful summer here in northern Michigan with spending time with friends and family. Speaking of family, if you have a loved one who needs additional help, Comfort Keepers help seniors thrive while living independently in their own home. I hope you enjoyed today's hot topic, brought to you by one of the greatest chambers around, Petoskey Area Chamber of Commerce. Thank you.
Thank you for joining us for another Petoskey Strong Focus on Health. I am Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined by Dr. Josh Meyerson of the Health Department of Northwest Michigan to talk a little bit, here we are into August, about where we stand in our community as vaccines have kind of leveled and cases have begun to increase again. It's been a while since we've had this conversation, but here we are circling back. And as we circle back, I think there's a couple key important things to talk about. And that's going to be where to wear a mask, when to wear a mask, who wears a mask, because we don't have mandates in place, but we do have safe guidelines from the CDC. And additionally, what kind of cases are we seeing in Emmett County and in the district, in the region right now? And what that means for our community and our businesses going forward, and how is best to approach that. So Dr. Meyerson, I'm just going to let you take the floor. Where are we right now?
Well, right now we are seeing an increase in cases across the country, across the state, across northern Michigan as a region, and in our county, in Emmett County. So if you go to the My Safe Start map or the CDC COVID data tracker map, or you can go to our health department and look at our cases. Over the last week, Emmett County would be in substantial or high community transmission. So what that tells you is that and that's trended upward over the last few weeks. So we're seeing increased community transmission. This is, most certainly in part due to our increased amount of people in our region, more gatherings, more get-togethers, more density, but also the Delta variant, I'm sure, is also a part of what's driving this increase in cases. But we are back to having, more, for several weeks, we had very little transmission. We all felt great about that, but it didn't go away. And now we're back to seeing increases in transmission. Our hospitals are reporting increasing numbers of people requiring hospitalization because of COVID. So that's where we are.
And we are, when we see that and we see ourselves in that high transmission space, the CDC did come out and say that if you are in an indoor space and you're in a high transmission community space area, then, vaccinated or unvaccinated, you need to wear a mask. So we're going to be seeing, and we already are seeing in our community, a lot of our businesses, some of them have already, we appreciate you wearing a mask. It's just plain, we appreciate you wearing a mask, not demanding, but really you're going to see more and more in that. And as a community, it's a great thing for us to do, a great example to set now when you're back in the grocery stores, back in those closed indoor spaces. Put a mask on as we're in this space, because we've done it before. A mask is not a big deal. We can do this. We've done it before. We can do it again. But we kind of have to right now, vaccinated or unvaccinated, to really help stop that spread, because the Delta variant, which is what everybody talks about, is so much more contagious, correct?
Correct, it is. It's more than twice as contagious as the original strain. But masks are still going to be, other than getting your vaccine, one of the most effective things you can do to reduce that transmission. So you're starting to see more people in our stores and grocery stores and retail establishments wearing masks. The health department, we've gone back to everyone, has to wear a mask when we're not in our own offices and things. So we've, we weren't excited about it. We weren't happy about it. We enjoyed being able to gather for lunch and everything, but now we're back to wearing masks. We can go outdoors and spend time together. We can still, do all the social things that we're doing, and we all learned to live with it for quite a while. So we're back to that because it's just the right thing to do.
Yeah, it absolutely is. It's the right thing to do. And a percentage of the cases we were speaking that, are in the unvaccinated population, and it's not hard to get a vaccine here, is it? It's quite easy, actually.
It is, right. And you mentioned a couple things, and I know, in our data in July, over 82% of our cases that were reported that we could track at the health department were in unvaccinated. And our hospitals still tell us the vast majority of people in the hospital are individuals who are unvaccinated. And then, Emmett County, if you look, and you can, look at our data, and the data that you'll see might vary a tiny bit, but Emmett County now is over 70% of the population is vaccinated, for the population that's over 12 years of age that can get a vaccine. So that's really good news. I think that's great. We still have people who can get vaccinated. Our young adults have lower rates in general. And that's an area, especially, that's our workforce that could really benefit from vaccinating and from getting vaccinated to keep them, at work, and to keep them healthy, and to keep those around them healthy. So if they are on the fence, I would hope with this increased transmission that might help drive them a little bit. We still have our pop-up clinics. We had a clinic yesterday in Harbor Springs. It was very well attended, more than we thought and more than we've been seeing in the last few weeks. And we have clinics every week at our health department, in our offices, in each office every week. And you can make appointments online. If you go to our website, you can actually schedule an appointment. And then, as you said, Nikki, lots of, offices and drugstores. There's a lot of places people can get a COVID vaccine, and whatever works for people is the best place for them to get it.
Absolutely, it is. Another question for you is that, so I know that there is, as we see the increase coming back in cases, we go back to questions of who is, if you're a close contact, when do you quarantine, when you don't quarantine. So we have to remember all these things again, but there is a difference than there was before. And that caveat is if you're vaccinated, correct?
Correct. Fully vaccinated individuals do not have to quarantine if they are exposed to someone with COVID, but we do have some recommendations. So if someone is exposed and they're fully vaccinated, they can still go to work, but we'd recommend they wear a mask at all times. That would even be if otherwise they didn't have to wear a mask. And I would really recommend they get tested around day 4 or 5 after that exposure, because that's when you're most likely to see if you had it. And if I was exposed, I'd want to know if I had it, because I'd want to really isolate, not just from my coworkers, but from people in my house, and certainly anyone else. So I'd want to know, and the negative test won't rule out me getting it, but it really would make you feel better. And then really to just kind of self-monitor for 14 days. And if you're sick, if you've been exposed and you're certainly having any symptoms at all, to isolate, get tested and all of that. But otherwise, they can go to work and they can be out and about. Whereas if you are not fully vaccinated, of course, we'd like you to quarantine for 14 days.
Right. Yeah, that's a big difference. And that's a great, another great reason, that you can and should vaccinate if you can. And I know too that you mentioned that we're seeing those lower vaccination rates in those younger ages, but we are hearing that a lot of the unvaccinated that are becoming ill with COVID this time around are younger too. So it's not as if you're young you can't get COVID. We're still seeing that.
Correct. And our hospitals, the average age of the people hospitalized has gone down quite a bit, because our senior population has very high rates of vaccination. So that's good for them, but they are seeing younger people, unfortunately, in the hospital, and some of them are quite sick. We have had a few small outbreaks involving workplaces and restaurants where they had, someone, an employee with COVID, and then all of a sudden 4 or 5 employees with COVID, and they had to close. And that was, in the busiest time in the summer, that was lost revenue. Definitely impacted their business. And that's unfortunate because it's preventable.
Yeah, that's a huge one. And we're aware of it too. And it's very tough for our businesses. It's a very hard thing to have to go through. So I think, the biggest thing that, we'll be watching for, and we hear it all the time, we get the question, are there mandates coming? Are we going to see, gathering restrictions, mask mandates again? And I think what people need to do is just use, regardless of what happens, on a state or local level, just use that common sense again and go back to being smart. If you're not outdoors, if you're indoors and you're in groups, wear a mask, you social distance, wash your hands. We've done it before, we can do it again.
Yeah, correct. And I don't get inside information, but I've not heard of mandates or those sorts or orders in that sense. So I think really it's going to be just more important for all of us to look at what is the smart, what is the the right thing to do for our own health and our family's health and those around us.
And just be nice if somebody asks you to put a mask on.
Yeah.
Be kind. You can smile at them afterwards. It's all good.
The golden rule, right?
Yes. Thank you so much, Dr. Meyerson. And, unfortunately, I'm sure we'll touch base again in a few weeks and see where things are, but I do appreciate you taking the time. It is, really important that the community stays informed. So our businesses need it and everybody does. So we appreciate you doing that.
All right. Thank you, Nikki.